going to wash my hands for 20 seconds per CDC guidelines. I'm going to introduce myself. Hello, sir. My name is Guillen Castillo. I'm going to be your nurse for the day. How are you feeling? Okay, great. I'm going to be asking you a series of questions here that I was just going to, safety check just to make sure you are who you are. Can you tell me your name? Check with the armband. Can you tell me your date of birth? Check with your armband. Okay. Another thing, do you know if you have any allergies to any materials or medications or anything like that? Okay, no known allergies. Okay, good. So now, what we're doing today is that we have an order to change your dressings on your sacrococcyx area. Now, what that is what we're gonna do is we're gonna be removing the old dressing. We're gonna assess it, make sure it's healthy, or if it's if there's any infection going on, stuff like that. Then we're gonna irrigate it, and then we're going to pack it with new dressings, and then put a new dressing over it, and then that's just basic wound care. Okay, do you understand the procedure? Do you have any questions? Okay, before we begin, do you mind if I assess the wound first, just to make sure that it's looking okay, or if the dressing came off or anything like that? Okay, lower the bed, lock in place, check environment, free of clutter. Gonna give the patient privacy. Okay, so just gonna look. All right, can you turn to your right side, please? Okay, there it is. Okay, dressing seems to be intact. Okay, now before we begin, this can be a painful procedure. Would you like us to give you any pain medication prior to the procedure? Okay, great. So I'm going to give you IV Dilaudid, all right? In 30 minutes, I'm going to check for your pain level to see how you're feeling, and then we'll go on from there, okay? Okay, 30 minutes later, I'm going to come back and check. Sir, what's your pain level at this moment? It's a 2 out of 10. Okay, are you ready to begin? Okay, great. So let's do this. Okay, so let's get started. I moved the procedure here so that way it's easier on my back, and it's more, you can see it. First, we want to apply clean gloves. No, wash your hands first. 20 seconds for CDC. Apply clean gloves. Now we're going to remove the old dressing, as well as the old packing gauzes as well. So remove that. Put the biohazard bag right here. Remove the inside. Now we're just going to assess the edges first. There's healthy granulated tissue, if there's any exudate, stuff like that, any signs of swelling or infection. Okay, so now we're going to assess the coca of the wound. We're going to check the color. Red would be healthy, yellow, serosanguinous, drainage would be infection, black would be like necrotic tissue. And then now we're going to check the entire coca. So the color is red with some signs of yellowing material. Now we're going to check the odor. There's no foul odor emitting from the wound itself. We're going to check the consistency. Consistency is scant, thin liquid, serosanguinous material draining, and then the amount would be scant. And then now we're going to check the dimensions of the wound. So we're going to see how deep it is, the width and the length. So now we're going to get the two, I have this to measure. I don't have the long one, so we're just going to be using these. First, we're going to find the deepest area of the wound. That would be here to the right side. Use the thumb to measure the length from the wound bed to the top of the wound. And you're going to measure that. Measure the width on the ruler. And then, the length as well on the ruler. Okay. So let's begin. We're going to irrigate the wound first. So we're going to put this here. And we're going to grab our pad here. I'm using a towel. And then we're just going to use this to further catch the debris that might be coming out when we irrigate. So to prepare our irrigation, open this, pour the top, a little bit of into the biohazard because there might be bacteria in the top. Pour it inside. Okay, now we're going to irrigate the wound until in one direction until it's clear. So just catch it. It's not clear yet. So we do it again. Catch it. Okay. So before we begin, if we need to obtain a sample, just get a cotton swab, dip it inside, and then send it off to the lab. Now we're going to make our sterile field now, so we just need to get rid of all this stuff because we might need this, so we'll just put this here. So we're gonna wash our hands, and then using only the 1-inch borders around, I'd be standing, well, I'll stand for this. And we drape it on, make sure it's not, nothing's touching the edges, nothing above, I'm not above, that might, contaminate as well. Now we're gonna get our sterile gloves here. Let me set them up because I was practicing. Make sure they look like they're in the sterile glove position, sorry. So, like so. Okay, so we'll see how this works. Okay, so now they're in sterile glove procedure. So you get your dominant hand, you grab the inside of it, because that's contaminated side, put it on. Grab the inside of the other, because that's the clean, sterile side. You apply it on just like a regular glove. And you just pinch it. If it's not cooperating, just pinch the side until it adjusts. Okay, now we're going to get our materials here. Would be this. There'd be the 2 tongs here. The tape would be inside, and the gauzes would be here. And the ABD patch would be here as well. So now we're going to pack the dressing. I'd be standing. Do not put your hands below your waist. Do not turn your back to the patient because that could also contaminate it. I'm going to grab our saline solution. I'm going to pour it onto the gauze here, like so. Put that to the side. Now we're going to apply the dressings. Fold them into a triangle, like so. And then you want to stick it. Be careful not to touch the edges of the wound, just because it might contaminate it. Just the inside, place it inside. I need another gauze. So we'll get another one here. We're going to pack it. We're going to fold it as well, same way. Lengthwise, and another fold. We're going to place it inside, like so. Then we're going to get our ABD patch and place it on. And then we're going to take the edge here, take the edge here, take the edge here, take the edge here. And then we're going to get another piece of tape. Initial date, time, put it on the tape, put it on, and then it's a wrap. So, and then gather all the materials, get your biohazard bag, clear the area, make sure the patient is in, the bed height is a normal height, everything is free of clutter, and that's it.